So after you give birth, you'll typically have some items to help with your postpartum recovery. One of them are these panties, which are very stretchy and disposable. So if they do get soiled, you can just toss and get another pair to wear. Sometimes after you give birth, C-section or vaginal, that your uterus still contracts to try to get back to its normal size. For some women, this is not very uncomfortable, and for other women, it's very uncomfortable, and they almost feel like they're in labor again. And so there are medications to deal with it, and some of the best medications are ibuprofen or Motrin. And if that's not working, you can always use Tylenol in addition, and also even use a narcotic like Percocet or Tylenol with codeine. So after you have a vaginal birth, it's normal to have vaginal bleeding, which we call flow, and that can last up until 4 to 6 weeks depending on the individual. It will decrease in time, so it will be that bright red, heavier bleeding, and that should diminish as time goes on through those weeks. And it typically will change to a brownish color, sometimes to more of a yellowish, whitish color, and then will go away, and that typically is about around 6 weeks or so. So these are nice because you can just go ahead and put the panty or the pad right inside, and you want to change your pad every time you get up to go to the bathroom, or when it gets or if it gets full and it's saturated with blood. So this is called a chucks, and this is something that will go under your body a lot of times during your labor, but in particularly after. And what this does is this will just protect your bed linen, so that if you're having some bleeding that maybe not be getting caught by your pad and panties, that your bed will not get soiled. And you can change this as frequently as needed. Some women can have some significant or perineal discomfort after having a vaginal birth, and there's medications to take to help to deal with that. You can take Tylenol, you can take ibuprofen, and if you're having significant or severe pain, you can also take narcotics like Tylenol with codeine or Percocet. So after you give birth, you'll have a routine which is called peri-care or perineum care. And one of the things you'll do, you'll urinate first, and then you'll fill this up with some warm water, and then you actually take this by your perineum and you squeeze, and this will put some warm water on your perineum to cleanse, but it can also provide some comfort as well. It's nice because you can use this while you're urinating, especially if you're having a lot of burning with urination. Another great thing, which isn't medication, is that you can put ice on your perineum, and the ice helps with swelling, to decrease the swelling that you may have, but it also provides comfort. One of the other things that you may see after you have your baby is this type of cold pack. And this is a pad, but it's also an ice pad within itself. So your nurse or you will be taught how to pop this or crack it, and it gets cold, and it can provide some coolness to your perineum. This promotes comfort, but also helps decrease some of that swelling or edema. There's also sprays or foams that are available to utilize on your perineum, one of them called dermaplast, and that's something that you can spray that kind of numbs your perineum where maybe you had a tear or stitches. That can help provide comfort as well.